Our first question today is from Lisa Yuzda, City News. Please go ahead.
Good morning. I think while many people will be very excited to hear that things are moving ahead, I think there's going to be a great amount of frustration that it's only coming now, like you mentioning that the call out to people to help with the vaccination campaign and at locations to increase the vaccination campaign are just being done when we heard from nurses and others, weeks ago saying that they were willing to step up. So why the delay to this point in time? And, when you're saying up to 5 weeks for people to get their booster dose now, is that the majority of people will have 5 weeks? Or will it depend on locations? I'm wondering how that will work.
Yeah, well, I'll start and then let Dr. Ballem. And I think we have been, of course, planning. You can't change these venues and ramp up everything in a very short period of time. And, of course, we had a very measured approach to this. And our focus has been on making sure those most at risk are getting their booster doses first. And that has been the overwhelming priority. But we have been focusing on this group of people getting to 6 months and have been planning for several weeks to ramp this up. And we have also brought on volunteers in the clinics that we have in place. And really importantly, we've expanded the work through pharmacies. So no, the average will not be 5 weeks. That's our absolute outside. Our intent is to get most people their vaccination, their booster dose within 1 to 2 weeks of their invitation. I don't know if you want to add to that.
Yes, thanks so much, Dr. Henry. And, I think we have been anticipating this with the onset of Omicron. It became evident over those 2 to 3 weeks prior to Christmas that we're going to have to make a switch. So the work has been going on. We have leased facilities. We're reaching out to immunizers. We're ready to staff and book. So I think, as Dr. Henry says, we're shooting for a 2 to 3 week average over the beginning of January, and that will get better. And we'll bring capacity on, literally day by day. So we're extremely grateful and enthusiastic about the response we've had from immunizers. We need to schedule them in now across the province and do our very best to, continue to expedite our booster campaign.
I was going to say that, I think that part of the issue with the booster campaign is that we announced our plan and laid it out in detail. On October the 26th, Dr. Ballem, Dr. Henry did that at that time. Since then, we've increased and we're over what we had planned for by 175,000 administered doses, 175,000 more than we planned to. Concurrently and after that, children 5 to 11 became eligible for the pediatric vaccine. A very significant number, 38% have already been vaccinated, 48% have registered. We encourage everyone to get registered. So we are dramatically ahead of the schedule that we put together on October 26th. And week unto week, 514 pharmacy locations now available, 254 to be added this week, another 200 by the middle of January. And I can tell you as well that for those people who have received their invitations, including the 240,000 who've received and not booked, there are in all health authorities, not in all communities, but in all health authorities, vaccine appointments available on January the 2nd. Even in Vancouver Coastal Health, where there's a relatively higher uptake in vaccinations. And so this has been an extraordinary effort, and we're building it out. And as you'll recall, when we laid out our plan on October the 26th, that the 6 month interval is important. And at that point, relatively few people that had their second dose 6 months before. We gave priority to those who are most vulnerable, and that program has been successful. So I think we're ahead of where we want it to be, where we expect it to be. And this is because you don't do 175,000 more boosters than planned if you're not bringing on resources and staff and locations and clinics. And this isn't done by machines. This is done by people who've given their heart and their soul to this effort. And I'm very proud of everything everyone's done.
Lisa, did you have a follow-up?
So many, but I'll stick with one. You mentioned earlier on, and I can't remember if it was Dr. Henry or who, or it was you, Minister Dix, about this being a mitigation approach. I think like most people, now know a lot of people who have COVID, whereas until now we've not known anyone personally who has and looking at sending kids back to school, about work going back, it just seems like it's a foregone conclusion that at some point everybody's going to get it, and this is just a measure to spread it out. Like, is there a way to avoid this virus at this point, or is it just a matter of time for everyone?
Yeah, really, really good questions, Lisa. You know, the virus has changed. And so, yes, the way it is spreading now, it's spreading much more rapidly. And that makes it really challenging because people are spreading it to those they're gathering with and those they're close to before they recognize that they have symptoms themselves. So a lot of what we have done has been really successful at making sure that we're not getting severe illness. So the fact that we have really high immunization means that the virus is no longer causing the types of severe illness we saw even with Delta a few weeks ago. So it absolutely has changed, but it's also spreading really rapidly. So everybody is going to be exposed. I think that's inevitable right now. But yes, we can do things to try and prevent us from getting sick and from passing it on to others if we get sick. And I think we have to accept that because the virus has changed, to adapt to the fact that we've all taken these protective measures, it means that it's spreading more rapidly, and we just have to try and do the best we can to, yes, stop that wave from, flatten it down. If you have 4,000 people and only 1% are hospitalized, that's a lot more people than when we had 400 cases and 1% hospitalized. So we need to balance that out right now. There's no, I think, I don't know anybody who doesn't know somebody who's had it recently. And that's a reflection of the virus changing. And so it's no reflection on the things that we're doing. How we're protecting each other and protecting ourselves is by the very high immunization rate we have. The booster dose will help again to make sure that we're keeping people out of hospital, and that's why we focused on people most at risk. It does help as well get more antibodies in our blood, so that does help protect against infection, but it's not 100% either. So we are seeing a lot of infection, and now it's affecting people's ability to go to work or go to school. So yes, there are things that we can do. One, we know that it's spread with people we are closest to. That hasn't changed. So it's spread when we're together with people indoors more than outdoors. So keeping those groups small. And that's why it's really important tonight. This is not a night to go party, because it is inevitable that somebody that you were with is incubating or is able to spread this virus and may not even realize it themselves yet. And we've seen that happen around the world. So we have to accept that that's where we are right now. And the things that we do that are most important right now are keeping our groups small, wearing masks when we're in indoor spaces, doing all of those things that we had in place that prevented spread in the past, and making sure that we're staying away from those who are most vulnerable. If we've had anybody in our social circle or in our family, in our group that has been positive for COVID, this wave is going to go through fast, what we have seen in other places. And what we need to do is make sure that we're protecting our healthcare system and that we're doing all those things together to get us through this wave too.
Our next question is from Richard Zussman, Global News. Please go ahead.
If I understand this correctly, 800,000 people have now just become eligible to get their boosters. Well, you're also saying that there continue to be priority groups. Pregnant women at 6 months. There was one mention at one point about essential workers at 6 months, but no clarity. I'm sitting here not at 6 months yet with 2 AstraZeneca. I have no idea anymore how quickly I could get my booster or anyone else could get their booster with 800,000 people now in the system. At our peak, I think we were vaccinating 80,000 a day. So, how long are people going to wait here to actually get a vaccine, considering there seems to be all these people that can now get it?
Yeah, so that's why our invitation system does it in a systematic way over a few days. So not every 800,000 are going to get their invite tomorrow. It's going to be based on that 182 days. So yes, if you're a pregnant person right now, call into the call center and identify, and you can get an appointment. But what we're doing and what we've been talking about today is ramping up the availability of boosters to meet that need. And it's going to be stretched over the next few weeks. You at 6 months, I think it's been pretty consistent in the last month or so that at that 182 days you get your invite. So wait for it. It will be coming.
Richard, did you have a follow-up?
Quebec has put in hugely significant restrictions. I think British Columbia, as you noted, Dr. Henry, is a week or so behind Ontario and Quebec. Should we anticipate additional restrictions here? Are there any plans to significantly reduce capacity for venues, as we've seen Ontario now do? When can we anticipate further measures to help curb the spread?
Yeah, so obviously I watch very carefully what's happening and have been in contact with my colleagues across the country multiple times. So from the very beginning, we have managed our own pandemic, and there are some things that are different and there are some things that are very similar to what's happening in other parts of the country. We've seen that over the last little while, where Delta became a really challenging issue for us to deal with, not so much in some other parts of the country. Right now, Quebec is dealing with a rapid increase in hospitalizations that has really strained their system, and part of that is a Delta wave that had just been starting in Quebec. So much of their hospitalization is not necessarily related to Omicron, but is at the same time where Omicron is causing healthcare workers to become sick as well. So the challenges are different in our different communities. We are using the data that we have here in BC and watching the patterns that we're seeing, looking at how it's spreading in our communities here. So the measures we're taking are to address what we're seeing and where we're seeing spread here in BC. So yes, we've made some changes this week. The one today that's most significant, of course, is the issue of trying to protect our long-term care homes through this wave. It will be the hospitalizations and ICU cases that will be driving if we need to do more. But we've also put in place some measures earlier than what we saw in other places that seem to be making a difference as well. And particularly, I know how challenging it is for many people in the restaurant and food and beverage industry and the entertainment industry. But not having those parties over this last few weeks is going to be really, really important for helping us slow this spread.
Our next question is from Amandaline Latario, CFJC News. Please go ahead.
Minister Dix, many smaller gyms have decided to stay open in the interior region despite public health orders to close. Will they be shut down?
Well, public health orders will be enforced, and I suggest that people follow them, and because they make all of us safer. These measures weren't put in place because anyone wanted to shut anything down or to limit any activity. In fact, most of these are activities, fitness, but this includes many of the activities that are restricted in these times because of the Omicron variant of concern. There are things that we could do safely that in normal times are good for us that we can't do right now because of the extraordinary explosion of cases of Omicron and of COVID-19 in BC. So my recommendation to everyone is that they follow these orders, which were put in place seriously, thoughtfully, and reluctantly, and do so until January 18th, when those orders will be renewed. And so we will be moving, as we have throughout the pandemic, to enforce those orders. We don't want to engage in enforcement actions because, frankly, we're busy. What we'd like people to do is to follow the rules, and we expect them to do so. And I know how hard it is for people in the fitness industry who've done a very good job through this period of 2021, in dealing, as we've dealt with previous waves. But the Omicron variant of concern, as Dr. Henry has said, as everyone in every jurisdiction has said, is different. And it doesn't allow us to do some of the things that we could do before without promoting the spread of the Omicron variant of concern. So what do we expect people to do? We expect them to follow the rules.
Mandaline, did you have a follow-up?
Yes, for Dr. Henry. We were told by Interior Health yesterday that it's not necessary to make an appointment to pick up a rapid test if you meet the COVID-19 symptoms criteria. But we're hearing that a collection center in Kamloops is not giving rapid tests out unless people have an appointment. Would you be able to clarify what the protocol is for this?
I can't tell you exactly which protocol each individual facility is following, and it has to do with their capacity and how many tests they have. So I think you'll have to follow up with Interior Health on that one.
Our next question is from Melissa Thibault, CTV. Please go ahead.
Oh, hi. This is for Dr. Henry. You had mentioned right off the top that you were concerned about staffing levels in healthcare workers in particular. And on Wednesday, you'd mentioned that, the province was considering following in Quebec's lead in changing the requirements for staff who are sick or who have been exposed to come back to work. Has there been any development on that since Wednesday?
Yeah, I know Quebec has been talking about this because their need is most acute. But from the very beginning, one of the things that we do in planning for our healthcare through a pandemic is to have different things in place to supplement staffing. So yes, we have been redoing that, looking at things like people who can be moved around, where we get casual pools, all of the different things that we can have in place, extending hours, all of those other things that are very, very challenging after 22 months of a pandemic. One of those is a last resort, is looking at fitness to work for people who are ill with COVID. Obviously, that is not something we want to have to do, and we are taking other measures like you saw today. Reducing visitors to long-term care is a measure that helps preserve healthcare workers because we can use them instead of screening visitors, for example, to supplement healthcare workers who are off ill. So there are many, many things that we have in place. But yes, as part of our pandemic planning, we do have what we call a fitness for work protocols, and I've asked the occupational health team to dust those off and review them and make sure that if we get to the point where we have such a high number of healthcare workers off that we cannot safely provide care, that those who have very mild symptoms or who are asymptomatic could work in some scenarios while they are why they have the infection. So that is something that we don't want to do. And I said this on Wednesday. It's having people go to work sick is not something that we ever want to do, and particularly not in healthcare. And we want to make sure that it's done only under certain protocols with safety measures in place and in certain parts of our healthcare system. For example, working with COVID patients, not working on a high-risk unit, for example. So yes, that is part of what we do for our healthcare, health human resource planning for a pandemic, and we've asked the team to review that to make sure that protocols are in place if we need them.
Alyssa, did you have a follow-up?
Yes, and so I guess you also mentioned that you're trying to recruit healthcare workers and doctors to try to ramp up the immunization program. So, are there enough workers to be able to carry out these vaccine appointments? And also, we've been hearing that N95 masks seem to be a big sticking point within the healthcare industry. A lot of doctors are saying that they're not getting enough. Will you be providing those masks to encourage more people to sign up for the vaccination program?
Two different issues there. So respirators, N95s, are used in the healthcare system when you're dealing with people with COVID, particularly in ICU or in the emergency department where the environment is very challenging. That's the focus. But vaccination clinics are not high-risk clinics for COVID infection. They're where people go who are not infected, the healthcare workers are not infected, and we go back to our basics of infection prevention and control. So the clinics are designed, that's what we have, what we call a hierarchy of controls, administrative controls, things like booking appointments, so you have a certain number of people that within the space, making sure ventilation is appropriate, having the immunization table spaced apart, making sure that everybody comes in is screened so they're not sick when they come in, that they wear a mask, that the healthcare workers or the immunizers wear masks and face shields and have all the appropriate PPE, are spaced from each other, don't gather together with their masks off and have lunch together. So those are all the things that we have in place. And in immunization clinics, which make them very safe. So a respirator that's probably one of the least places that you would require it. It is important and it is available as part of the PPE that's in across our healthcare system.
We have time for one more question. Our final question today is from John Hernandez, CBC. Please go ahead.
Good morning. Dr. Henry, regarding the change to isolation time for fully vaxxed people to 5 days, is it up to individual employers to determine if an employee can return to work when they have no fever but mild symptoms? Especially in non-essential sectors, many workplaces still have a 14-day policy in place. So is your message to them to review that?
Yeah, that is. I think, I'm hearing from many different parts of industry that they're concerned about people being ill right now as this wave is coming through. So this is my advice for people who have mild or no symptoms at all, that 5 days is an appropriate isolation period with the wearing of masks in all of those settings for an additional 5 days. Each setting will have to figure out, every workplace will have to figure out how that fits into their business continuity planning, making sure that we have other things in place. So if you're working in a food processing plant, we need to make sure that there are things to protect the other workers. It is a mitigation strategy. There is a small risk that some people will still be able to spread the virus. That's why it's important to continue to wear masks, to have the distancing and the ventilation and the barriers and those other things in place. But yes, it is a measure to help address some of the worker illness that we are starting to see and is likely to get more acute over the next little while. So we're happy to work as we have all along with WorkSafe and with industries to help them beef up their thinking around the COVID safety plans and how does this work to make sure that workers are protected in their workplace too.
John, did you have a follow-up?
Yes, I do, and I'll ask actually to get both answers in French again after this one here. But when it comes to the booster dose program, why do you think we aren't seeing the buy-in from some people? Why do you think there's that 240,000 unbooked invitations? Those people clearly aren't vaccine hesitant if they already have 2 doses. And, it's just the last day of 2021. Do you think we'll still be here last day of 2022?
Oh, I don't know. I hope not. It's hard to know. We've heard from some people that they've actually got their boosters other places that may not have put them into the system. We've also, there is a proportion of people who've left the province or who aren't here right now. There are some people who it's just not convenient for them or they don't feel they wanted it at this point, including some healthcare workers who haven't got around to it yet. So we're really putting a push on to try and encourage healthcare workers. It's important for us to do everything we can to make sure we can stay healthy. I don't know if there's other additional reasons, but those are some of the things that come to mind. I think some people get frustrated and think that there's not an appointment available, and we want to tell you to go back and try again, because we have ramped up the number of places and the appointments that are available. And then now with pharmacies coming on, it makes it much easier in many different communities to be able to go to your pharmacy.
And I just want to emphasize, when people are booking, the default for proximity is 10 kilometers. So that's what will come out. And so when you originally seek an appointment, it'll be those within 10 kilometers. You can change that and broaden that, especially for those who are close to transit in many cases, or have a car. That's one can go 20, 30, 40, and then suddenly there's significantly more appointments available. I think people are enthusiastic about the booster dose campaign. I get questions and requests, and certainly requests personally through email and others all the time. So I think there's enthusiasm. We've done more than 900,000 boosters in BC. It tracks slightly behind, I'd say, second doses in general. And as you say, all the people who, by definition, are getting a booster dose who are eligible for a booster dose have had 2 doses. So I think it's too early to say there's a lack of enthusiasm. What I'm saying to people who have had their invitation is, this is the moment. Like right now, right here, right now is the moment, either through our phone line or at our Get Vaccinated website, to book your appointment. And I know people booked appointments in the city of Vancouver, where there's high demand, on January the 2nd.